we're back, and today my special guest is Dr. Seth Yandell. He's a physician here at Hastings Hospital here in Tahlequah. And welcome to the show today.
Thank you. I'm glad to be here.
Today we're going to talk a little bit about cancer awareness and the issues around cancer and the importance of screening and those kind of things. So Dr. Yandell, tell us a little bit, maybe a real quick overview about why we should really have a high awareness and understanding about cancer and what it can mean to our lives.
Sure. Cancer right now is the #2 killer of people in America. So it's a broad health issue that we should all have a tremendous awareness about. It sits right behind cardiovascular disease as one of the most common causes of death in America. And it affects 1 in 2 males throughout their lifetime, affects 1 in 3 females throughout their lifetime, and pretty much everyone that you know knows someone who's had cancer or has had it themselves. So it's a tremendous health burden across the country.
And what is the most common form or the prevalent form of cancer from your experience and statistically?
So we look at it in a couple of different ways. One, the cancers that cause death. So lung cancer is by far the #1 cause of death in both men and women. If we looked at the overall incidence of cancer, if we looked at something as simple as skin cancer, squamous cell and basal cell cancers, there are about 1.5 million of those cases in the U.S. a year. Now those, a lot of times we can treat topically or just with excisional therapy. When we look at the big cancers that really affect life expectancy, for women, if you looked at the #1 cancer that they have, it's breast cancer. For men, it's prostate. But certainly when we look at death, which is probably the most important thing in mortality from cancer, then it's lung cancer.
I know one of the things that from health fairs and different programs that I've attended is the fact that screening technology and just the medical field has really brought screening up front and is so accessible today, and unfortunately we don't take advantage of it.
That's certainly true for the things out there like pap smears, mammograms, colonoscopy, where we can really do good screening. We've got newer tests for things like prostate cancer. We don't see that there's enough people that take advantage of that. People with health insurance typically take advantage of those services more frequently, but ones without any sort of coverage tend to ignore that part of their health care.
Well, a big part of the awareness program, education program, would be prevention. Tell us a little bit about some preventative measures that our viewers can be concerned with.
Sure. So there are things that we can affect about our lives, like our genetics, your family history. Those things you're born with, and there's not much that we can do about that. But there are certainly things that we can do to help prevent certain types of cancer. I would start with the simple things. Do things like wearing hats and clothing when out in the sun, putting on sunscreen if you're going to have prolonged sun exposure, because we do have a significant burden of skin cancer, and that's a very simple preventative thing that we can do. Obesity has been shown to be highly associated with the incidence of cancer rates. So eating a good healthy diet is certainly recommended by the American Cancer Society, and trying to keep your weight under good control. If we looked at things like eating fruits and vegetables as opposed to red meats, which are associated with certain types of cancers, including colon cancers. And then another biggie is smoking cessation. Tobacco is the biggest risk factor for lung cancer, and it's also closely associated with many types of cancer. And we know that once somebody stops smoking, after about 10 years, their risk of malignancy goes down to about the baseline of somebody who's never smoked. So
really,
it's very important to try to quit smoking if you can.
I know the Cherokee Nation and other public health groups have really pushed education and awareness about smoking and tobacco use. Are you starting to see any impact of that awareness at this point?
We certainly are seeing those programs being used more frequently. Whether that's decreasing the overall numbers or not yet, I don't think so.
Probably a little early to tell.
Yeah, it probably is. That's something that you probably need a 5 to 10 year sample of. But we certainly are seeing that those services are being used on a more regular basis. The problem with smoking cessation is it's just such a hard thing to stop.
Yes, it is.
And all the support we can give them, we should at every avenue.
And one of the things I was in a conversation with Dr. Gloria Grimm, and I have a granddaughter, and I wasn't quite aware of how important it is for especially small children that they need that sunblock.
That is absolutely true.
We think about adults and we're outside and we're mowing the yard, we're playing softball, whatever it might be, but even the children need that special attention.
Absolutely. When we look at skin cancers and we do things like questionnaires of people that develop them, as little as 2 to 3 sunburns as a child is a significant risk factor for developing skin cancers as an adult. So it's very important for the adults to watch over their children because they're not aware of it. They want to go out and play.
Well, it's
and
summer. We're supposed
that's
to be
right.
outside.
They're supposed to, and you know, the parents are like, well, when I was a kid, I didn't wear sunblock. I ran around and played. But well, I think we have much more awareness now about the risks of sun exposure. And it's not just sun. You should avoid things like tanning beds. People are using a lot of tanning beds these days, and we certainly are seeing that there is an association between skin cancers and tanning beds. So tanning beds are not safe either.
Where do you see us going the next 3 to 5, 7 years about cancer treatment, cancer testing, cancer screening? Where do you see the future coming for medicine in that area?
Treatments are complicated because they really depend on the types of cancers that you have and the extent of the cancer that you have. One of the things that's really important when we talk about screening is when we look at any spectrum of a cancer, the larger or more widespread a cancer is, the less likely we are to cure that, and the more likely it is to lead to your death. So early detection is probably the most important thing that we can do. So doing things like, you see the new vaccine for the human papillomavirus, which actually is associated with cervical cancer.
Okay.
And so now we're starting to vaccinate young women with this human papillomavirus vaccine to try to prevent the occurrence of cervical cancer in adulthood. So I think things like vaccine therapy, if we can target a certain thing that's associated with the cancer, is a wave of the future that's just now starting. When we look at targeted therapies, they're starting to do things where they can alter viruses to specifically target certain types of cancer cells, and so that's a new target that's out there that's being looked at. And then genetics. So as we look at the Human Genome Project, and they're identifying genes that are more associated with certain types of cancer, in the future, 20 years from now, you might be able to get a blood test and be able to say what your risk of certain types of cancer are based on your genetic profile.
We hope that they keep moving it forward. We're just about out of time. If you could give us 15 seconds of here's what you need to be watching for when you're 40 or 50 or 30 or whatever the age brackets might be, just real quickly on awareness of cancer and screening and testing.
The most important thing I would say is see your physician on a yearly basis and talk about the different screening that's available for whatever your gender is. So for women it would be things like cervical cancer, breast cancer you're looking to prevent, colon cancer for both sexes, and prostate cancer for men.
Very good, with some great advice. Dr. Yandell, we really appreciate you being on this part of the program today. And we need to have you back so we can talk some more about some of the health issues and some of those things that we can be watching for as we listen to our physicians and take their advice.
I'd be happy to do it. Thank you.
Thanks for being here, and we'll be right back.